Hello, my name is Steve Schapiro, and I'm going to be talking to you about behavioral management strategies that allow non-human primates to voluntarily participate in their own care. This might be different from some of the other webinars you've watched. We're going to have a lot of video in here, and I have some of my colleagues in the room with me, so it's going to be sort of a live presentation in addition to the webinar kind of thing. So if I giggle, it's because of what they're doing to me. Okay, so I'm the one giving the talk, but there are a whole lot of people that have really contributed to all the work that you're going to hear about today. Here are some of them. There's actually quite a long list and a couple more. And obviously the chimpanzees, I'm going to talk a lot about chimpanzees. They're also very much involved in the work that we do here. And as the title of the talk says, I'm going to talk about how laboratory primates can participate in their own care, and here we just see a very quick example. I'm going to go into much more detail about this as we go along, but here's a chimpanzee receiving the nebulizer, or more importantly, voluntarily cooperating with the administration of the nebulizer so that we can treat a lung problem that the animal had. So that's the type of thing that I'm going to end up talking about most as we go through this. So I'm going to start with an introduction to behavioral management. That's really what all of our work here at the MD Anderson Cancer Center in Bastrop, Texas is about. Our work, the behavioral management group. And what we usually talk about in terms of behavioral management is that it's just part of regular colony management, but we emphasize three behavioral components. We focus on socialization strategies, environmental enrichment, and positive reinforcement training. And today, I'm not going to talk much about socialization strategies or environmental enrichment. Most of what I'm going to focus on today is positive reinforcement training, and more specifically, how we can use positive reinforcement training to get the animals to participate in their own care. That's really the overriding focus of this talk. Now, everything we do with behavioral management is designed to give the animals opportunities to express species-typical behaviors. We give them the opportunities, and then it's up to them to make use of the opportunities. So we want to give them the chance to behave like normal non-human primates, and then they have to take advantage of those chances. And, you know, we have to fit into the regular husbandry system that's going on at all times, and we have to fit into a facility. There are things that we can't do because the way the facilities are designed, and there are things that we can do because of the way the facilities are designed. And that's really going to be fairly important. So what we really try and do is functionally simulate natural conditions in captivity. Again, this gives the animals the opportunity to behave normally. We focus on socialization, enrichment, and training. Like I said, we're going to really emphasize the training. And again, it gives the animals opportunities to control what happens to them and to make meaningful choices, something that isn't typical of the way that you keep non-human primates in captivity. So behavioral management is really designed to give the animals the opportunities to exercise control and choice. So why do we do this? Why does the University of Texas MD Anderson Cancer Center employ not one but two comparative psychologists to work in their comparative medicine program? Well, the real reason is that the comparative psychologists, myself and one other guy, we can help better define the animals as models. So if we define the animal models better, we can increase the quality of the models, and we can increase the utility of the models, how they can be used, how generalizable they are, how valid they are. And that's really where comparative psychologists fit into comparative medicine, into laboratory animal science. At least that's the way we fit in. And the really cool thing about this is that not only do we get to help make better animal models, but in doing so, we improve the animal's well-being, or welfare, or wellness, whichever term you want to use. They really mean very much the same thing. So all the behavioral management strategies that I'm going to talk about today, and many of the other ones that are not being talked about today, are all designed to make the animals have higher welfare, better welfare, better well-being, better wellness, okay? And we always say that we're trying to maximize their welfare. This is a continuous process. We are never going to be finished with making things better for non-human primates in captivity. We are always going to strive to do more and more. But what I'm going to tell you about today, or what I'm going to emphasize today, are techniques that we're using that we think take captive care to the next level. We're pretty good at socialization, we're pretty good at environmental enrichment, and at this point we're pretty good at training. But what we want to do is do even more. We want to take it further. We want to take it to the next level, and that's hopefully what you're going to pull out of today's broadcast, or whatever it's called. Okay, we have chimpanzees here at MD Anderson. Chimpanzees have been in the news a lot lately for how they're treated in research. Going forward, all chimpanzees in research are going to have to be maintained in what are called ethologically appropriate environments. So I'm going to talk a little bit about ethologically appropriate environments. It's not well defined what an ethologically appropriate environment is. But I'm going to tell you about some things that might be characteristic of ethologically appropriate environments. And the current emphasis is that chimpanzees must acquiesce when you do research with them. I don't like that term. Acquiescence sounds to me what your kid does when you ask him to clean his room. He acquiesces to that. What you do when your wife asks you to take out the garbage, you acquiesce to that. That's not really what we're looking for. We are looking for voluntary participation. And I'm going to show you a lot of videos as we go through this. And one of the things that I want you to be thinking about is, or one of the things I want you to be evaluating is, are the animals voluntarily participating? And I think that's critical to the future of non-human primate research, and especially chimpanzee research at this point. So pay attention to the VPs for voluntary participation and the EAEs for ethologically appropriate environments. Okay? There are a couple of questions that I want you to have in your head as you listen and watch this thing. I want you to think about whether human convenience has too high a priority in the techniques that we use to manage non-human primates in captivity. So the question really is the relative priorities of human convenience and animal needs. I would call these human needs, but we really don't need the animals to be in cages. It's convenient for us to keep the animals in cages. So I really think that human convenience gets a little bit too high a priority and animal needs get a little bit too low of a priority. One of the things that I hope you'll think about as we go through this is ways that we might be able to balance out the priority a little bit so that animal needs get a slightly higher priority and human convenience gets a slightly lower priority. So, the way we cage them, the way we feed them, the groups that we house them in, the light cycles, and even research time points. If you study rats and mice that are typically active at nighttime, I know we're really talking about primates, but if you did all your time points on your rats and mice in the daytime during their non-active period, is that really going to give you meaningful information for the things that you're trying to do? So just, keep those things in mind. I'll have a couple of other things that I'd like you to think about as we go through. And I'm a primatologist. I'm very focused on primates. I really feel as though primates need more behavioral management than do rats or mice. So they live in very complex societies. They're very intelligent. So even the simplest thing can be difficult to do with non-human primates, and therefore it requires what I'm going to call behavioral management. We're going to look at a video in a second here, and what it is going to be feeding a group of chimpanzees one of their favorite foods, frozen yogurt. So what I'm trying to illustrate here is even something as simple as feeding a group of chimpanzees one of their favorite foods is something that requires quite a bit of behavioral management. So you're going to see a celebration. Chimpanzees, when they find a favored food source in the wild, make a celebration or perform a celebration. You're going to see that here. It's not the same as finding a fig tree in the wild, but it's the arrival of their favorite thing, frozen yogurt, and it's a functional simulation of what they might experience in the wild. So if we play this first video, you'll get a chance to see that. They also throw. So, okay. Hello. I guess we're back. So I hope you had a chance to see a little bit of what goes into feeding animals their favorite thing. And maybe you saw some things that you figured needed behavioral management. Maybe there was a little aggression directed at other individuals. Maybe there was a little self-directed aggression. These are the kinds of things that we have to watch out for and manage when we keep non-human primates in captivity. Okay? So again, what we're trying to do is encourage natural behavior patterns. We got to create an environment that functionally simulates natural conditions. Again, this is this ethologically appropriate environment concept, and it's the social environment, the physical, sensory, and occupational, which includes feeding, all those different aspects of the physical environment. And then we also want to train the animals so that they can exhibit some control and choice. And we're going to call that, as I said, voluntary participation. Okay, so how are we going to take behavioral management to the next level? So we're pretty good at training. We've been doing it a long time, and we want the animals to voluntarily participate in these different things that we do with them. So, you know, maybe that's a high level, but it's not the highest. The next level that we want to take our behavioral management to is we want the animals to manage their own care, and particularly their own health care. And I'm going to show you some examples of that. It involves voluntary participation in positive reinforcement training things, but what we really want is the animals to have a way to communicate with us and for them to exhibit and make choices, and us respond to their choices. So that's what I'm going to emphasize as we go through. And taking behavioral management to the next level is really important. It's in the newest edition of the guide. It's going to be in all the guidelines for using chimpanzees in research from the Institute of Medicine and from the National Institutes of Health. So we really have to get on this, and we've been doing it for a while, so I think we're in a good place to, move forward with this. And there are two more questions that I'd like you to think about as we go through these examples that I'm going to show. What exactly does the animal find rewarding about what we're doing with it? So the reason animals come back to perform behaviors again and again is because of the reinforcement that they receive. What is it about the reinforcement that's rewarding to them? I want you to think about that. And it's really the same question, why do they continue to participate? And maybe that'll come up in some of the things that I'll show you near the end, okay? So I'm just going to run through a whole bunch of different examples of positive reinforcement training. I'm going to show you a lot of different behaviors that probably have use in a lot of captive management situations. So I kind of want you to be thinking about two things. I want you to be thinking about, hey, would these behaviors be useful for me in my situation? And I also want you to think about what's the reinforcement component of what the animals are doing and receiving from participating in these things. So again, it's all about voluntary participation. We have husbandry things we do, we have veterinary things we do, we have research things that we do. We want the animals to voluntarily participate in those things. So as I told you, the goal of behavioral management is to make a better animal model, better defined animal model. It's the same for positive reinforcement training. We want to use these techniques to make a better animal model, one that's of higher quality and can be better used. So that's what it's about. So in this little video, you're going to see a variety of different behaviors by a rhesus monkey male living in a group with 5 or 6 other females. And again, what I want you to think about is, would these behaviors be useful to me? So if we play this video, we can, you all can see it, and I'll talk to my friends that are here because I can't talk while the video's going at the same time.
Good boy. Hold, hold. Good boy. Come out your legs. Hold, 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 hold. Good boy. Very good.
Okay, we should be back. You should have seen a rhesus monkey do a variety of different behaviors. Again, think about, was this voluntary? And I hope that you come to the conclusion with all the different things that we see that the animals are voluntarily participating. If they move away, we just call them back to their spot. There's no punishment involved. I'm going to show you that in a second. So, I'll show it to you right now. There are very few situations in which punishment can be used in laboratory animal science. It's just not the right way to go. Animals don't learn from punishment, so we don't use it, and very few people do. I don't think it's used very much at all. Some people use deprivation, so animals are hungry or thirsty when they start to train them. Our animals are never hungry, basically, and are never thirsty. All the things that they do for us, they do just because they want to. They're not in the least bit deprived. So our animals are motivated to participate basically because they want to. Okay, you all pretty much know what positive reinforcement training is about. You ask an animal to do something, the animal does it, and the animal gets a reinforcer or reward, something it likes. You ask an animal to do something, it doesn't do it, what happens? You give them a big old shock? You give them a smack? No, you just don't, the animal simply doesn't get a reward. Okay, so that's all there is to positive reinforcement training. It's fairly simple on paper or on a slide. It's a little bit more difficult to actually do well. So trainers, our trainers in particular, are very skilled at the things that they're doing. So I'm going to show you just a very quick clip of some squirrel monkeys, a squirrel monkey that's been trained to touch a hand. So if we look at this video now. Very simply, that animal's trained to touch a target. We'll just look at some owl monkeys, which are now trained to touch, I think, hands. So if I could have this next video. Okay, so hopefully what you saw was some owl monkeys and some squirrel monkeys doing some very simple behaviors, but that's where we build our behavioral repertoires from. We train them to do simple things, to target, to station, to touch, and from there we can get them to do more and more important things, and you'll see some of that as we go. All right, so we feel that there are a lot of different benefits to using positive reinforcement training techniques. I'm going to focus on just the two that are in yellow there. We have diabetic animals that we need to present a finger or a toe so that we can get a capillary blood sample. We also need them to present their belly so that we can give them a subcutaneous injection. These are things that you could not do if your animal was not trained. So this is a new capability that comes about with training. And I told you a little bit about the nebulizing situation. Obviously, an animal that's not trained to come up and stick its face in a mask, you can't use the nebulizer as an effective treatment. We use the nebulizer 3 times a day for 20 minutes at a time. Anesthesia would not work in that scenario. And so, because these animals have these additional capabilities, you can do better research with the animals. You can treat them better than if they weren't trained. So those are the values of having animals that are positive, trained using positive reinforcement. We're going to look at this video very quickly. This is an animal who's trained to test her Lixit, her water source, so that we don't have to go in and do it. So if we play this video.
Okay. Jane, go check your Lixit. Jane, go check your Lixit. Good girl, Jane!
Okay, so perhaps you saw that Jane the chimp got her reinforcement in a brown paper bag. We do that on on purpose. We don't necessarily want her to know what the reinforcement is going to be. Some things she likes, some things she doesn't like, and if she doesn't like what we have as a reinforcer, she's not going to work. Using a brown paper bag is sort of like a slot machine kind of thing. Sometimes she gets a big jackpot, sometimes she just gets a little bit of popcorn, but she never knows what's in there. That's one way to keep the animals motivated. It has nothing to do with deprivation. I'm going to skip that video, Don, so we're going to advance, one more video past that, okay, when it comes time. So I'm going to show you some videos of animals giving access to their bodies for exams. We can look at body parts, we can look at wounds. If we had infant chimps, we could look at the infants. We can get a variety of different readouts for this. So if we can show video number 7, that's 07, that's what I'd like to do now.
Open. Hold. Good. Good girl.
So maybe you heard a whistle in that. We use that as the same as the clicker. It's a secondary reinforcer. Tells the animal that you've done what we asked you to do, and here comes your real reinforcement. We gave her grape juice after we brushed her teeth. Not the smartest thing to do from a dental hygiene point of view. It probably should have been a fluoride treatment or something like that, but you can see that the animal's willing to do it. And again, think about whether it's voluntary or not. I'm going to show you a whole variety of different medical behaviors on these 2 chimpanzees that come next. And it's similar to what you saw the rhesus monkey do, but let's have a look at that one now.
Climb. Foot. Good boy. Hand. Hand. Good boy. Good boy. Chest. Hold. Hold. Good job. Turn around. Turn around. Good boy. Good job. Zippy. Open. Open. Hold. Good boy. Joey. Come on down here. Turn around. Oh, good boy. Hold. 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 Hold.
Okay, so hopefully you saw a variety of different behaviors there that could be of use to you in your management system, whether it's chimpanzees or rhesus macaques or whatever. Again, the idea is to get the animals to voluntarily participate. I'm going to move along a bit. We're going to have animals present for injection. That's really important to what we do. And I'm actually going to show you some data that go along with this particular behavior. It turns out that the best antibiotics for chimpanzees are injectables. They're much better than the oral antibiotics. So if you have an animal that's sick, you don't want to have to anesthetize him in order to give him his antibiotics. You want him to present for the injection, as we saw the rhesus monkey do a little while ago. And similarly, we have to anesthetize our animals for their annual physicals, and we would much prefer that they presented for the injection of anesthesia than if we had to dart them. And I'm going to show you some data about that as we go. And when the trainers train the animals, they usually do very, very well. But when the veterinary technician gets involved, we often have regression. The animals no longer perform the behaviors for the trainer that they used to because the veterinary technician is there. So what we do is we involve the veterinary technician early in the training process so that the veterinary technician no longer has the negative connotations that he or she had prior to the training. Okay, so let's look at this video now. It's going to be of an animal getting an injection. It's a mock injection. It's not anesthetic because we would not anesthetize an animal while it's in its social group. So let's play this one.
Move your leg. Good girl. I want you to hold, hold, hold. Good girl. Okay, I'm going to take the cap off. Move your leg. Hold, hold. Good girl. Now I'm going to stick you. Okay? Ready? Ready? Good girl. Very good. Excellent. Your leg.
So when you do the behavior, we went through several steps. We used the cap syringe to start with, then a small poke with the needle, then a full poke. And when the animal does the behavior that you asked for, it gets the big reinforcement, the big banana at the end. So you have to go stepwise. You don't just jump in with an injection with a sharp syringe. You have to use successive approximations to train the animal to do what you want. And that's what all training is about. Okay, so I'm just going to show you a couple of quick graphs that show some data. What we're very much interested in is whether the technique you use to anesthetize the animal affects the parameters that you get from the blood samples from the animals. And here's the first bit of data addressing this. We have a whole bunch of animals that we had to anesthetized non-voluntarily. We also have a whole bunch that voluntarily presented for their injection of anesthesia. And as you can see, there's a statistically significant difference in the blood glucose that came out, that was in that blood sample that we took. Similarly, when we look at the same animal within subjects design now, we had 79 animals who we had an a voluntary present for injection blood sample taken and a non-voluntary blood sample taken, non-voluntary anesthesia episode. You can see that we see the same pattern of statistically significant differences in a positive direction when we look at blood glucose. So the way that you get the way that you anesthetize the animals in order to get the blood samples affects the parameters from those blood samples. And I'm going to say a little bit more about that in a minute. Okay, so there are a whole bunch of other things that we can get the animals to do using positive reinforcement. We can collect samples, urine samples, semen samples, blood samples. I'm going to skip the next video, which is a urine sample, and I'm going to move on to a voluntary blood sample using what we call the blood sleeve. And this is video number 11. So let's have a look at this one. Wait, one second.
Hold. Move this. Okay, put that back. Good boy, Terry. Hold. Good boy, Terry. Good boy, Terry. Good boy, Terry.
She's filming this neither of us have masks on, showing her.
It's a brand new thing. Good boy. Good boy, Terry. Good boy. Hold, Terry. Good boy. Good boy.
Hold. Oh, sorry. So what you saw there was a voluntary blood sample. The animal holds onto a pin at the end of the tube. That's what really sets up the whole behavior. We were able to get multiple tubes using a vacutainer and a little catheter. And that's how much effort goes into getting a voluntary blood sample from a chimp. No darting, no anesthesia, nothing. So we had 7 chimps that we did a study on. They gave a voluntary blood sample on Monday, and then they gave a non-voluntary blood sample and an anesthetized blood sample on Thursday. And just looking at our blood glucose again, we see the same pattern of statistically significant differences when the animals are allowed more control over what happens to them. And the most important thing about this particular graph is that the voluntary blood samples give you blood glucose values that are outside the published normal range for chimps. Now, the normal range for chimps, the published normal range for chimps, is derived from anesthetized blood samples. So one of the things we're working on is trying to come up with non-anesthetized normal ranges for chimps, which we think are probably more valuable in a lot of different circumstances. All right, so I'm not going to show you the Reese's venipuncture. It's pretty much the same thing. I'm running a little short on time, so I want to make sure I get everything in. So we're going to talk a little bit about diabetes in chimpanzees. We have a lot of older, fatter chimpanzees that are at risk for developing insulin-dependent diabetes. And in fact, we have 65 chimpanzees that are 30 years of age or older, 7 of whom are 50 years of age or older. So we are worried about the same type of old age health issues that humans are worried about. So what we want to do, we have to be able to monitor their blood glucose. We really want to do it from a capillary, from a toe or a finger. We want to be able to administer the insulin using the subcutaneous injection. We clearly are expecting more animals to develop this problem over the years. And what we want to do is get ahead of the curve. We want to be out in front and have animals that are already trained to provide us with these capillary blood samples. This is just a picture, but let's have a look at this video. And again, the question is it voluntary?
Good foot. Good boy, hold. Hold, Smokey. Good. Hold. Hold, Smokey. Good boy, Smokey. Good job, buddy.
Okay, well, that was some video of a rhesus monkey giving a voluntary blood sample. What I'd really like to do now is show video 13, a chimpanzee giving a capillary blood sample. So maybe we could do that.
Joey hand. Good boy. Hold. Oh. Good hold, Joey. Good boy. Okay. You put your hand on this one. Good boy. Good boy. Good boy. Good hold, Joey. Hold. Good boy, Joey. Keep holding. Good job, Joey. Good. Good job.
Okay, so what you saw there was a capillary sample from a chimpanzee, again, and the glucometer reading. You pretty much saw the whole story there. We're going to skip this one. This is just a subcutaneous injection of Lantus or insulin that you've seen similar things already. I'm going to skip this about the glucometer and diabetes. I've already talked about it. There are these iStat machines that can do cage side chemistries and hematologies, and it's really the same principle. So I'm going to skip that and move on to just a couple of quick cases. So we had a chimp with pulmonary problems. He had a dry cough. This is the nebulizing story. We didn't know where it came from. We took an x-ray before, then we nebulized for 3 weeks, and 3 times a day, 20 minutes at a time, and then we took an x-ray after. So I want you to have a look at his lungs beforehand. You know that the lung on... Okay, the lung on your right is a bad lung. The lung on your left is a good lung. And what we wanted to do was try and clear up that bad lung. The animal used the nebulizer. I'm going to show you a quick video of that nebulizer right now. So if we could please show video 16, that would be great. Okay, so there perhaps you saw some voluntary nebulization, or maybe you're still seeing it, I don't know. And now we can look at the lungs prior to the nebulization and some antibiotic, and after some nebulization and antibiotic, and I hope you see that there's some clearing. It's not perfect, but it did a good thing, and the important point is that without the animal being trained, we could not have done the nebulization, and that was a critical component of this. Okay, and I'm not going to show you this because I'm running out of time again, but this is the cage mate of the animal that was nebulized. She didn't need nebulization. She had nothing wrong with her lungs whatsoever, but she wanted to participate in the training that the other animal got. So what you would have seen in this video is an animal requesting nebulization with just saline and getting it. So when you start thinking about voluntary participation, here we have the perfect example. This is an animal who didn't even need the treatment, but wanted the treatment and the attention that comes along with it. All right, so another case, we have a chimpanzee with a very bad set of heart problems. One of the things we want to do is be able to monitor that animal's heart. And so what we can do is take that implantable loop recorder that you see here. It's about as big as a thumb drive. What we can do is we can implant it in the animal's back. Normally humans have it in their front, but chimps are likely to pick it out, so we put it in the back where it's a little less likely to be picked out. And now we can, this recorder records everything that the animal's heart does for about 2 weeks. So every 2 weeks we can interrogate the recorder, we can pull the data off the recorder and see what's been happening with that animal's heart. So here's just a quick video of the animal presenting its back so that we can get the information off the recorder. This is video number 18.
Hold. Hold. Nope, we got him back. Hold. Hold. Okay, we're running again. Hold. 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 Hold.
And we have it all.
Good boy, Adonis! Woohoo! You did it!
It works. It's recording everything.
Okay, so hopefully you just saw some video of the animal presenting its back so that we could get the data off the loop recorder. And really all it needs is a banana and a scratch on the back, and it's going to hold for the 45 seconds to a minute that it takes to get all the data off the recorder. So one of the last things I'm going to tell you about is how we treat arthritis with our chimpanzees. We could use drugs, you know, NSAIDs and anti-inflammatories and those kinds of things. But again, this whole talk is about taking behavioral management to the next level. We want to take our treatment of arthritis for the animals to the next level. We have a certified veterinary acupuncturist here. So what we want to do is make use of her skills. We want to treat the animals with acupuncture for their arthritis. The way you do that, obviously, is you insert needles, of course, but the animal has to be trained to sit, which our animals already are. They have to be trained to stay. Again, our animals are already trained to do that. And once they're trained to sit and stay, all you have to do is just desensitize them to the needles a little bit, and it works perfectly. And I'm going to talk a little bit about laser therapy and about self-medication too. So I don't want to show us putting the acupuncture needles in. It's pretty straightforward, but what I do want to show you is taking the acupuncture needles out. So that's video number 20. Let's play video number 20. Time to take it out. So there's like a natural timing mechanism that the body has to get, to get these out. Okay, so hopefully you saw some acupuncture needles coming out. Obviously putting them in was the same process in reverse. We've had very, very good success with acupuncture as a treatment for arthritis. We've published a little paper about it. The animal's gait improves as a function of the treatment, which is critical, and the animal's activity improves, and I'm going to show you a little bit about that next, or in a second. The other thing that I want to tell you about is using a therapeutic laser. The important thing about this laser video that I'm going to show you now is that the reinforcement for the treatment, which is acupuncture with the laser, is not food. There is no food given to the animal in this treatment, okay? The reinforcement, the reason why the animal comes back to get the treatment again and again is because it makes him feel better. And this, to me, is one of our most important steps towards animals voluntarily participating in their own care and taking captive care to the next level. So now the animals are coming up to get their treatments, not for food, but for the effect of the treatment. So let's see video 21, please.
Good boy, Sammy.
People, but we're still one less than we started with. Oops, I'm back again. Okay. So the important thing about this laser therapy and the combination with acupuncture is that the animals are doing it because it makes them feel better. That's the reinforcer. And to me, that's a critical step towards where we want to go. Now, the next thing that I want to talk about is also an arthritis treatment. Chimpanzees in the wild, when they feel sick, will self-medicate. That means when they have a bellyache, they go and eat a particular plant that they know cures their bellyache. So A, they know they don't feel well. B, they know that there's something in the environment that can make them feel better. And C, they go and consume that thing from the environment to make them feel better. So we wanted to sort of functionally simulate that here in captivity, and we wanted to do it with for a problem like arthritis. Again, we have 65 animals that are over 30 years of age, and we have a number of animals with arthritis. So we can give them the choice between meloxicam and ibuprofen as their treatment for arthritis. So how do we give them that choice? Well, you do it in this very particular way. You have an arthritic chimpanzee. For 2 months, you give it meloxicam in blue Gatorade. Okay? That's all it gets as a treatment for that period. Then for 2 months, you give it ibuprofen in green Gatorade. That's the treatment that it gets. Okay? And then after you've done that and reversed it, so it's an A-B-B-A design, you give the animal the choice between blue Gatorade and green Gatorade, which is meloxicam versus ibuprofen. So now the animal can tell you which of the two medications it prefers. So now the animal is treating itself. Every day for 60 days it has a choice between meloxicam and ibuprofen, and it can choose how it wants to be treated. Okay, so I'm going to just show you some very stupid videos of just the way this study goes. It's very simple. Okay, so if we can show video number 22, it's simply the two squeeze bottles of juice. .22. That was quick. Okay, now I'm going to show you video 23, which is the animal drinking green Gatorade, just to prove that it does it. Video 23. Boy, that was fast. Now, video 24, the animal drinking blue Gatorade. Well, that didn't really work very well. And now, the animal making a choice between blue and green Gatorade. Video 25.
10 score, thank you. Wait, Emily and you guys, did y'all copy?
Okay, maybe you saw that the animal made the choice. Maybe it was a little hard to see. During a pilot phase of this research, we compared blue and red. And so now I'll just show you a quick video of an animal making a choice between blue and red. It's a little easier to see that it was a choice in this particular video. Video 26.
Which one do you want? Which one would you like? This one. Good. Red.
that I have to fix. Okay, so there we have a situation. The animal is telling us which medication it wants, and during the choice phase of the study, M is meloxicam, I is ibuprofen. You can see that there's a statistically significant preference for meloxicam over ibuprofen for every single animal and for the group as a whole, and it doesn't matter whether the meloxicam is in blue Gatorade or in green Gatorade. The preference is for the medication, meloxicam. Now let's look at a little bit of behavior, because we collected some behavioral data from this. There are 3 conditions: meloxicam, ibuprofen, and choice. And we'll look first at locomotion. So you would think that if an animal is feeling better from its arthritis, that it would be locomoting more. You can see that there's really not a gigantic difference between meloxicam and ibuprofen, but look at the yellow bars for choice for animals 2 and 4. Now, there are no statistics that we can perform on these data, too few subjects, et cetera, but perhaps when the animal is given a choice, rather than just having one medication, maybe it feels better, maybe it acts better. In this example, we might say it locomotes more. Looking at the next example, we can see that for the first 3 animals, for sure, they spend more time in social proximity to their group mates when they can make a choice. Okay? Remember, one of the things we talked about was giving animals control over what happens to them, allowing them to make meaningful choices. And now we'll look at inactivity, a behavior where we would hope for a decrease as a function of the arthritis medication. And we see, again, for animals 1, 2, and 3, important dips in inactivity when they're allowed to make the choice. Okay, so these are very preliminary data. Don't bank too much on them. We're not banking much on them, but we really want to do, we want to continue to pay attention to this so we have a good feel for how important control is to the animals. And with that said, the last thing that I'm going to talk about is that we want to give animals control over aspects of their environment. We want to do this through a video game platform. If you're familiar with the Xbox Kinect, you know that the Kinect allows you, or the chimp in this instance, to control the game. So the chimp is the controller. Other video games, you need a wand, a baton, whatever it happens to be. And unfortunately, chimpanzees are very rough on those types of controllers. But when they're the controllers themselves, you can use that to your advantage. So the animal is going to appear on the screen in the interface that we give it, and it's going to behave in a particular way, and maybe there are going to be very particular results from the way it behaves. So the first thing you want to show is that chimpanzees recognize themselves on the screen. And I'm not going to show this video because I'm pretty much out of time, but it's simply a chimpanzee looking into a video camera with a monitor right next to it. And the chimpanzee is exploring its tongue, exploring its ears, its face, its nose, etc., doing socially unacceptable things, of course, because that's what chimps do. And to me, and I'm sorry I can't show it, it proves quite clearly that the chimp recognizes itself on the screen. So now we have a control panel that's up on the screen, and we have the chimpanzee in that virtual environment, and we want it to be able to control what happens to it. So we want it to be able to turn the fan on and turn the fan off. We want it to be able to turn the light on and turn the light off. We want it to be able to change stations on the radio. So this last video that I'm going to show is a chimpanzee who is in an environment where she has to put her right hand up into that green box on the virtual screen in order to stop the crickets from chirping. So let's show the final video, number 28, and you can see how it works. Well, that really wasn't the right video for what I was trying to demonstrate, but you can see we're marrying the Kinect technology with the chimpanzees in an effort to get them to be able to control their environment. So I'll just sum up what we really want the animals to do is participate in their own care. It's all about behavioral management, in which we're trying to functionally simulate natural conditions. We want the animals to express species-typical behaviors so they'll be a better model. This improves their welfare and wellness. That's what we're all about. I think that when we do choice procedures like we did for the arthritis medication, meloxicam versus ibuprofen, we're opening new channels of communication with the animals. We're giving them an opportunity to tell us how they want us to work with them. If you followed the Kinect stuff, you really probably couldn't, but if we use the Kinect properly, the animals will get an opportunity to control what happens to them and control their environment. All this is based on us trying to take captive care to the next level. And I asked you to think about a couple of questions as we went through. You know, what we're trying to do is get some insight into what's reinforcing for the animals. Why do they come back for the treatments? And we saw that a little bit in the acupuncture and the laser because it makes them feel better. And, you know, some of the other work that we do as well, you know, it's all designed to figure out how we can benefit the animals the most. So my time is up. It seems as I'm still on the air. But I'd like to thank you for listening and watching, and my apologies for some of the things not working out quite the way they should have. And I want to thank my people here who, despite everything being on like a 6-second time delay, didn't give me any crap about it. So I don't know exactly what to do next. I don't know if I can see questions or not. But I'd like to thank you again for listening. Yeah, they can hear that.
You have to unmute the phone here?
Well, yeah, I could hear him talk if he talked on the phone. Oh, maybe I need to click on Q&A. Not a question, but I love that you brought up the question of convenience versus needs. Thanks. I've been reading about Steve Martin and Susan Friedman's Blazing Chickens. Don't know anything about chickens, only know things about monkeys. Oh, there we go. Thanks a lot. All the event is worth it just because of this. Well, that's good. Thank you very much for saying that. I'll have to find out who you were. Great presentation, Steve. I don't work with non-human primates, but the videos were very illustrative. Cheers. Well, there we go. I really don't know what to do next. Hey, Don, what should I do? Click on Q&A. All right, I already did that. There's really not much that I can say about all done. Okay. Okay, well, thank you again for all your time. Let's eat. I'm just going to leave it the way it is. Okay, well, there we go.